One of the main ways that our body converts thyroid hormone is in the gut. And so you really can't isolate these things. The slower your thyroid, the slower your gut is going to be. When you're stressed, your body is not worried about clearing your bowels, or you can see it the opposite. You can kind of have that dumping syndrome. Everybody's probably experienced that. You get a little nervous, you start running to the bathroom. Chronic stress over time is going to slow the bowels because you're diverting blood flow away from the gut into your muscles because your body doesn't know the difference between whatever stressor and actually being chased by a bear.
I am super excited to chat with Dr. Heather Finley. Dr. Heather Finley is a registered dietitian with a doctorate in clinical nutrition. I am going to chat with her about thyroid health and the gut. She has her Hashimoto's journey. I have my Graves' disease journey.
There's a very strong grief and stress component to my thyroid diagnosis. All of a sudden, my face was super puffy. I was so tired and I could barely function. And I remember going to my PCP and telling her, there's something wrong. Can we run a thyroid panel? And basically being told, well, you're not overweight, so you don't have thyroid issues. You're probably just depressed.
So do you see that also in a lot of the clients that you work with as well, that relationship between stress and thyroid as well as the gut?
I always tell people,
let's start out with a little bit more of your background. So how did you start focusing on helping people with different types of gut issues?
I always tell people, as sad as it sounds, I was born constipated. And that sounds really, really dramatic. But to be honest, I really don't remember a time in my life where I didn't have stomach pain or GI issues. And to be honest, I thought that it was normal until I realized, in my teen years that not everybody had stomach aches every time they ate, and not everybody went a week without a bowel movement. And it just got me very curious about nutrition and health and so many things. I was also an athlete and a swimmer and decided to go to college to study nutrition. And selfishly, I thought I was going to college to study nutrition from more of like a sports nutrition perspective, thinking, okay, I'm swimming in college. What do I need to eat to swim as fast as possible? And maybe I can fix my gut issues in the meantime. And the reality is that I ended up graduating college worse than I ever felt. I was so bloated, so constipated, having horrible GI issues, and felt like a complete imposter. I thought maybe I'm just not getting something. Maybe I chose the wrong career. Maybe I don't know what I need to do, but thought, if there's no way, how am I going to help other people if I can't help myself? And so started my first job as a dietitian in a clinical setting in the hospital. And throughout that time, just that kind of further, that belief of maybe I chose the wrong career just kept getting stronger and stronger, thinking I'm definitely in the wrong place. And that's around the time that my dad got really sick from colon cancer. And unfortunately, he ended up passing. And that's where the Hashimoto's and the hypothyroidism came into play, and where I really started kind of seeking out alternative methods for health after he passed. And I believe that there's a very strong grief and stress component to my thyroid diagnosis. All of a sudden, my hair started falling out. My face was super puffy. I was so tired. I was like falling asleep while talking to people, and I could barely function. And I remember going to my PCP and telling her, like, there's something wrong. I do not feel well. Can we run a thyroid panel? And basically being told, well, you're not overweight, so you don't have thyroid issues. You're probably just depressed. And so you should take an antidepressant and go to therapy. And, you're just grieving the loss of your dad. I went to another provider, kind of got told the same thing, and then finally ended up at this other doctor's office. They ran a thyroid panel. And not only did I have hypothyroidism, I had Hashimoto's pretty severely. My antibodies were super high. And for the first time, I felt like completely validated, like, okay, there's something wrong. And they were doing a little bit more of kind of alternative stuff. They had recommended, some vitamins and some supplements. And that was kind of the first time someone had recommended something besides like, just take Miralax or just do this. And honestly, that opened my eyes to this other world. ended up going back to school, like you said in the beginning, to get my doctorate in clinical nutrition with kind of the goal, again, of healing myself. It was more of an integrative program. And that's really where I learned to put the pieces together and realize that it's all connected: your thyroid, your gut health, your energy, your hormones, everything. And yeah, I kind of made myself my own case study and then started integrating stuff with patients that I was seeing. And here we are. So it's been quite the journey.
Yeah, sounds like it. So I would say it's hard to believe that you went to two doctors who refused to do a thyroid panel, but I've heard that story before where people go into multiple doctors and not really considering thyroid. And then sure enough, they eventually find someone who's willing to do a thyroid panel. And in your case, also the antibodies. And like you said, you were diagnosed with not only just hypothyroidism, but Hashimoto's. And just going by, I guess, the lack of some classic symptoms, just maybe, again, obviously they can't tell how someone feels, but then they look at you and say, well, you're not gaining weight. You mentioned you aren't gaining weight. And, when I dealt with chronic Lyme, I wasn't having the classic Lyme symptoms. So the doctor wanted to refer me to a neurologist, and I ended up seeing a functional medicine practitioner and got diagnosed with chronic Lyme. So it happens with all different types of conditions. But yeah, just, and then you mentioned the impact of stress and grief. So do you see that also in a lot of the clients that you work with as well, that relationship between stress and thyroid as well as the gut?
We see it all the time. It's so hard. You can't isolate these symptoms. And I think people often shut down when you tell them, well, stress is one of the reasons that you're having symptoms. And so the way that I like to explain it to clients is stress is not just stress about your job or even a family situation. There's so many other things that cause stress on your body, including having imbalances in your gut, being overtrained, which I for sure was overtrained. I was running way too much. I was training for triathlons. And so I was overtrained and under eating. I wasn't sleeping enough. And all of those things, we always refer to it with our clients like a stress bucket. My stress bucket was overflowing and I didn't have any inputs that were decreasing stress on my body. And so it's easy to think, oh, well, if stress is causing my issues, then I'm never going to get better, without realizing that there's a lot of things that we can remove or improve in our life to manage stress: sleeping more, hydrating, eating enough, getting enough rest, doing things that are fun and having joy and pleasure in your life. I mean, it doesn't always have to just be meditation like a lot of people think, or something that's unachievable or unsustainable. So yeah, there's a huge stress component, and often not in the way that people think.
Definitely agree with the overtraining. That described me as well prior to my Graves' disease diagnosis, just the overtraining and doing some extreme dieting as well. So you're right. It's not just the emotional stressors, but the physical stressors we need to consider. So question I have, since we're going to be talking a lot about the gut, in your opinion, is it possible to heal Hashimoto's without having a healthy gut?
I don't think so, or at least I haven't seen that, because it's so connected, as you know, and you talk about so well on your podcast. You have so many episodes on that I've listened to in the past, but I mean, it's all connected. Everything in the body. One of the main ways that our body converts thyroid hormone is in the gut. And so you really can't isolate these things. We often see it's really bidirectional. So our clients that have undiagnosed thyroid issues, they stall when they're working on their gut if they don't realize they have thyroid issues. And I think the opposite is also true. From a thyroid perspective, if you have a big gut infection or you have an absorption issue and you can't absorb nutrients from your food, then it's going to be really hard to get to the other side. And I even saw that with myself too.
And then you also have a quiz. So I checked out your quiz, Why Am I Bloated quiz. And the very first question you ask is, have you ever had a food poisoning event? So I wanted to talk about this because we really haven't spoken about food poisoning. And a lot of people overlook this, because again, maybe it happened years ago and they forgot, or maybe again, they just really didn't think about it. But I'm sure there's a reason why this is the first question that you ask. So if you could explain why you asked this question at all, let alone it be the first question on your quiz.
So there is this huge bucket that I'm sure many of your listeners have heard of before. It's called IBS, irritable bowel syndrome. If you've ever gone to the doctor and you've told them, I'm bloated, I'm constipated, I'm having diarrhea, and perhaps they've run some testing, maybe they've done a colonoscopy or an endoscopy or whatever, and everything's come back quote unquote normal, they'll often lump you into this bucket of you just have IBS. And it's kind of this bucket of like, we don't really know what's wrong with you, but your bowels are irritable for whatever reason. One of the number one triggers of IBS is food poisoning. Same thing with SIBO, or small intestinal bacterial overgrowth. And what happens when someone has food poisoning is that it damages the nerves of the migrating motor complex. And your migrating motor complex is kind of like this after office hours cleanup crew. So after you've left the office for the day, it's the crew that comes in and takes out the trash and, vacuums the floors and does all the things. And that's what it does in your gut, is it kind of sweeps things through to clean things out. You don't want food or things sitting in your gut and fermenting and overgrowing and producing gases like methane gas and hydrogen gas. And so if you've had a history of food poisoning, especially if you've had a history of food poisoning that you can really identify, like, yes, I remember the one time there's this one client that sticks out in my mind, and it's relevant to when we're actually recording this podcast around July 4th. She said, I know what happened. I went to a July 4th barbecue and I ate some watermelon and it was bad. And I've never felt the same since. And a lot of people have that story. And then there also are people that, perhaps they have had food poisoning and they don't remember getting food poisoning, and maybe it was really mild. But either way, what happens is it damages the nerves of the migrating motor complex, which affects your motility, which is the movement of food and waste through your bowels, and the body's ability to really clear stuff out. And so things sit and they ferment and slow down, and it affects the whole process. So food poisoning is a very important thing to know about related to someone's history.
So if someone's digestive symptoms began after a food poisoning event, then that's definitely something they need to pay attention to, is just that. And especially if they're having like those bloating and gas symptoms that are so common with IBS and SIBO. So that when you do your health history and you ask that question, do you get sometimes people just saying, you know what, I don't remember. Now I remember because you brought it up, but like I never even thought about that. But yeah, like 11 years ago, I got food poisoning. And ever since then, again, I didn't think about it until you asked that question. So do you have that happen sometimes?
Totally. And we'll have people that'll say, oh yeah, that reminds me, I traveled abroad and I got really sick. And then I thought I was okay, but you're right, I haven't quite been the same since. So it's sometimes, you're right, people just haven't connected it yet. And it kind of triggers this whole process of, for us, knowing someone's health history and timeline is really important, because oftentimes there is a triggering event like food poisoning or a really stressful period in their life or whatever it might be. But it really is kind of a domino effect for a lot of people over time. And maybe that was the straw that broke the camel's back. But what made your gut so vulnerable to that food poisoning? Because not everybody that gets food poisoning ends up with really severe gut issues. And so we want to understand what happened before and after that as well, that really set you up for being susceptible to that too.
And then, so if someone tells you that their symptoms started after a food poisoning event, like, does that change your approach? Are you more likely to recommend like a SIBO breath test? Like what would be some of the next steps? Or like, do you do, I don't know if you do comprehensive stool testing on everybody, but I guess I'll let you take over and chat a little bit about that.
Yeah, there's several things that we can do and look at. And I think it depends too on somebody's symptoms, but a SIBO breath test could be helpful if their symptoms are kind of looking like SIBO. But honestly, I prefer a comprehensive stool test, like you mentioned, just because it's going to look a lot more at the why. It's one thing to know if you have SIBO, and that can be important, of course, as part of the picture. But then we're still going to be asking the question of, like, how did these bacteria get in your small intestine when they're not supposed to be there? Is it a digestive insufficiency? Is it a motility issue? Which that you can tell, if someone says, I don't go to the bathroom every day, or I go to the bathroom, but it never feels like enough. Or, what a lot of our clients say is I am constipated for 3 to 4 days and then I have diarrhea. So they have like overflow diarrhea. So yeah, a comprehensive stool test can be really helpful. And then there are things like even lion's mane mushrooms can be really helpful for repairing the nerves. There's other probiotics and things that you can do, but we love recommending things that are going to help like turn everything back on.
All right. Wonderful. Let's talk a little bit more about constipations. Now, you said kind of, again, like you said, you had constipation for a long time. You mentioned you were born with constipation, but did you also have did you take a lot of antibiotics when you were younger? Because I know I did, and I experienced chronic. I would go twice per week in my teens and 20s. And I don't know if it was just the antibiotics, but I took antibiotics pretty regularly when I was younger. So it sounds like that, or you're nodding your head. So it sounds like that's the case with you as well.
Yeah, I mean, I was a product of the 80s and 90s where antibiotics were just kind of common practice, right? Like you get a mild ear infection and here's the antibiotics. And so, yeah, I took a lot of antibiotics as a kid, and I'm sure that did not help. And so that's a big trigger for a lot of people, especially in like the little years when your gut is just so vulnerable. One thing I probably have never shared this publicly, but I have 3 kids, and one of my goals with my children, obviously, if they needed antibiotics and it was life-threatening, of course I would give it to them. But one of my goals was trying to get to age 2 without antibiotics. And so far, 2 out of 3 were there. My other one's not quite 2 yet. She's only 7 months. But, it's amazing to see. My kids are super healthy. They rarely ever get sick. And it's just incredible to see what really fostering a healthy microbiome can do. And, it's nobody's fault. It's just there was a lack of knowledge at the time. People didn't even know what the gut microbiome was when I was a kid. So the science is still really new, which is kind of wild to think about.
Yeah, I agree. And I agree. That's a good goal for, children, obviously adults too, to minimize antibiotics. There's time and place, but the longer you could go, you could have your children go if they need it, absolutely need it. I agree. But unfortunately, a lot of children, including myself, and it sounds like you too, it was very common. And many times we took the antibiotics when we didn't need the antibiotics. So what are some other factors? Low thyroid can cause problems with motility. Again, SIBO we mentioned. So are those some of the more common things you see in your practice? And if there's anything else that you'd like to mention when it comes to constipation?
Yeah, I would say that there's a handful of things that we commonly see. Food poisoning, like we mentioned, being one of them. Definitely thyroid issues. We see tons of undiagnosed thyroid issues, and it's often a huge hurdle for our clients to end up getting the right testing. And obviously we can run testing, but I can't prescribe thyroid meds, and I can't, so it's finding a provider that we can work with there, or figuring out how we can do it from a more holistic approach as well for some people. So yeah, thyroid issues, the slower your thyroid, the slower your gut is going to be. Just to put it very simply. Another piece that we see contributing to slow motility is stress. To bring it back to stress, when you're stressed, your body is not worried about clearing your bowels, or you can see it the opposite. You can kind of have that gut brain reaction of that dumping syndrome. Everybody's probably experienced that. You get a little nervous, you start running to the bathroom, but chronic stress over time is going to slow the bowels because you're diverting blood flow away from the gut into your muscles, because your body doesn't know the difference between whatever stressor and actually being chased by a bear. Another thing that we see contributing to slow motility is upper GI related stuff. So low stomach acid, low elastase, or poor pancreatic output, and poor bile flow. You need to be able to break down your food, and you need stomach acid, enzymes, and bile to do that. And so if we're seeing a disconnect with how someone's actually breaking down their food, specifically with stomach acid, your stomach has to fill with acid in order to empty. So we see people that have been on PPIs or chronically stressed over time or taken things that have lowered their stomach acid. And as a result, everything downstream with motility isn't working either. And then the last thing that I'll mention, which is very, very common, is just mineral deficiencies. Minerals are like the spark plugs for energy for our body, and we need minerals to like turn the electricity back on. And then it's kind of a catch-22. You need minerals to make stomach acid, and you need stomach acid to absorb minerals. So you often have both that you need to address and kind of systematically, but specifically things like sodium and potassium. Magnesium is going to help draw water to the bowels, but potassium is going to actually help those bowel muscles to contract. So it's like finding the right combination of things for people as well.
So sticking to the topic of low stomach acid, there's not a really great test to look for stomach acid. So do you just assume that most of your patients have it, or do you do things like the betaine HCl challenge? Like, I guess when it comes to determining if someone has low stomach acid, like what approach do you take?
I'm not a huge fan of the betaine HCl challenge just because I don't want to irritate an ulcer or something that's there that we don't know about. But that is a strategy that you can do. What we prefer to do is something called the baking soda test. So essentially you're consuming quarter teaspoon of baking soda and water, seeing if you burp. If you burp within 3 minutes, likely stomach acid is okay. If you burp within 3 to 5, would say that you kind of halfway passed. And then if you don't burp, which is very common for our clients, likely you failed. But we can also look at testing too. We have some clients that are like, I'm not doing that, or, the results were kind of inconclusive. Obviously, it's not a clinical test. It's just a little experiment. But it's something cheap and easy that you can do at home. But some things that we can look for on testing would be on a stool test. If we see really high fat in the stool, so steatocrit is high, that could possibly indicate low stomach acid. If we see pancreatic elastase is low, that can possibly indicate stomach acid is low. And then on a hair mineral test, one thing that we often see related to stomach acid is low sodium, as well as cobalt being off as well. That can indicate perhaps some digestive insufficiency. So we can look at testing, we can look at the baking soda test, and then we can also just look at symptoms. Does it feel like food is sitting in your stomach like a brick? Are you bloated 1 to 2 hours after eating? Do you have undigested food in your stool? Are your stools greasy? Incomplete, et cetera. So usually we're kind of pulling from all of that and trying to figure out, could somebody benefit from bitters or some kind of digestive support like betaine, like you mentioned, in a lot of cases. Oh, and then I guess the most obvious thing on testing that I didn't mention would be H. pylori. H. pylori is the most common infection in the world, and it lowers stomach acid. And so, if someone has H. pylori that's really high, likely there's some issue there. And so we want to address the H. pylori.
I agree. And then also, like, they could go through your quiz because you asked some questions that could kind of point them in the direction to see if they have maybe low stomach acid. And you mentioned one of the questions that when going through your quiz you asked is about the greasy stools as well. And so you mentioned low stomach acid. Could that also be a sign, like if you have greasy stools or stools that like kind of stick to the toilet, like also problems with bile flow too, or? If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter.
Yeah. And, we do see that a lot in our thyroid patients. The gallbladder and the thyroid and all the things. You need bile to absorb fat soluble vitamins. And we know that even like vitamin D is very important for the thyroid. So those two things can be connected. But yes, greasy and sticky stool often indicate perhaps low stomach acid, but also, does somebody have a gallbladder? Are they actually creating enough bile and surging enough bile, or is their bile flow kind of stagnant and more sticky, sludgy bile? So do we need something to help improve that as well? So they often definitely go together.
And I would imagine you agree that there are too many gallbladder surgeries these days. Not to say there's not a time and place for them, but way too many people get their gallbladder removed.
So many. I mean, I was even talking to someone today who told me, yeah, I just had a couple gallstones. And so they took my gallbladder out 6 or 7 years ago. And now I'm having recurrent SIBO and upper GI pain and all this stuff. And I wish that wasn't the case, because I hear that all the time. So we see a lot of clients like a couple years after gallbladder removal that now have other GI issues. Bile flow. Bile, I always tell my students in my practitioner course, I'm like, bile is really the MVP of digestion. Without bile, nothing else works. It is an antimicrobial. It helps coat the lining of the small intestine to prevent bacteria from growing there. And so really, like, we need bile. And so we really need healthy gallbladders for that.
Yeah, and I'm bringing up this conversation because I also had, just coincidentally yesterday, my wife was asking me questions about the gallbladder, and it turns out she knows someone whose 15-year-old daughter scheduled today as we speak. So she probably already got the gallbladder surgery. And I just told her, I mean, the gallbladder is not usually the problem. It's usually, like a bile metabolism problem. Just it could be affected by diet, could be affected by like oral contraceptives, and just again, ideally, especially, I hate to see anybody, but let alone someone that young who, again, for all I know, maybe they did see a holistic doctor, but my guess would be they probably didn't. They probably just were developing gallstones, which again, it's very young age, experience at 15, but just again, just I think about half like 500,000 gallbladder surgeries, something like that in the United States, like 500,000 per year. And again, some of those need to be done, but a lot of those could have been prevented at least. So a lot of times they need to be done because they get to the point where it becomes like an emergency situation. But if the person was more aware of some of the factors that cause the bile metabolism problem, and anyway, that's why we're having this conversation, is to try to prevent people from, if at all possible, which many times it is possible, to prevent them from getting their gallbladder removed. So what are some other common gut issues that you see in your practice? Actually, let's before you answer that question, what are your thoughts on parasites? Because again, there's a lot of different perspectives with parasites. There are some people that treat everybody for parasites. There are some people that just do stool testing. And I know you said you do stool testing, maybe not specifically for parasites, but there are people that will see if the stool test comes back positive for parasites, they'll treat it. If it's negative for parasites, they won't treat it. So I wanted to get your perspective when it comes to parasites.
There's so much controversy over parasites. It's very interesting, especially in the online Instagram world that we live in. You see some crazy stuff online. So we definitely have clients that have parasites. We see it on testing, but I definitely don't treat everybody for parasites. That being said, we have put clients on protocols for other things, and they have passed what looked like a parasite. So I think a lot of people, parasites are a normal part of our environment. Not all of them are necessarily like going to cause tons of issues. Do you want to have a ton of parasites in your gut? No, absolutely not. But it can be very easy to get like very terrified on the internet about parasites. Sometimes when you see people posting about like parasite cleanses and showing pictures, not everything they're posting is an actual parasite, although it might look like that. So just, yes, people do have parasites, but probably not as much as maybe the internet makes you think, or maybe that's not as much of a problem as the internet makes you think.
Yeah, I would agree. So it sounds like we're on the same page where you don't treat everybody randomly for parasites, but in some people they can be an issue.
Totally.
Anything else as far as like what you commonly see that you wanted to talk about? I'm sure you see a lot of things, but anything like really common in your practice that we didn't chat about as far as gut related issues?
One thing that I think is really important to mention, especially with the thyroid, is that we actually see a lot of depleted gut microbiomes. So it's, whether you've done stool testing before or not, for somebody listening to this, it's very easy to go into a stool test thinking like, what bad bacteria is going to be on my test? And I need to just go and kill off all this bacteria in my gut, which certainly can be the case if you have SIBO or something else. But a lot of times we see clients that it's really not an issue of like too many quote unquote bad bacteria. It's actually an issue of like lack of diversity in your gut, lack of resilience of your gut, a low gut immune system. So the marker for that is secretory IgA. And so we see clients that, they've done so many elimination diets, they've done so many gut protocols. And as a result, their secretory IgA, which is basically like your gut's bodyguard, it helps prevent things from residing in your gut that shouldn't. It helps keep your immune system healthy and strong. That's super depleted. And so that's why people are having so many food sensitivities and food reactions. The lower your IgA, typically the more food reactions you will have. And part of that picture is that they're keystone bacteria, so things like bifidobacterium, akkermansia, persnitzii, these are all keystone bacteria that are just so depleted that their gut has zero resilience. And it's easy to blame or easy to think that bad bacteria are to blame or SIBO's to blame. And the reality is that their gut just needs some love. It needs some prebiotic fiber. It needs some good probiotics that are going to reside in their gut. It needs some production of short chain fatty acids. And it needs that to help reduce inflammation, to help, if somebody has Hashimoto's and they have antibodies, one of the best things that you can do from a gut perspective is to help feed good gut bacteria in your gut. Because when your good gut bacteria have food, they produce short chain fatty acids, which those are anti-inflammatory to your body, to your brain, to your gut, and is overall going to reduce inflammation, therefore, indirectly improving that antibody picture that you see.
All right. Well, thanks for that. I like that, the gut's bodyguard. So I've not heard about that, but I agree. Secretory IgA, see a lot of it. Many people have that depressed secretory IgA. So definitely want to get that to healthy levels. So the thyroid, so getting back to the thyroid, what testing do you recommend? It sounds like you recommend the antibodies, but can you get a little bit specific, like what antibodies? Do you look at reverse T3 in your patients?
Yeah, so we have a variety of people that come to us, some with thyroid testing and some without, but I really like to look at the whole picture. So I want to see antibodies, I want to see free T3, I want to see reverse T3, I want to see the whole picture. And one of the common things that we see is low free T3. Is that something that you see in your practice?
Yeah, I deal with a lot. I work with Hashimoto's, but I do see more people with Graves. So obviously the people with Graves usually have the opposite problem. They have the elevated free T3. But I do see a lot of people when their thyroid is so-called normal, where the TSH is within the lab range, which doesn't always mean it's within the optimal range, but T4 will also be looking okay. But yeah, that T3 is low. So maybe that person has a conversion issue, which I'm not sure if that's where you're getting at. But yeah, I do see, when I don't see the hyper patient with the elevated thyroid hormones, it is common to see that T3 on the lower side. And many times, I'm sure you see this too, where it's, again, within the lab range, but it's within that optimal range. So that free T3 might be like 2.3, which would be within most lab ranges, but kind of lower than we want to see.
Yeah, so their TSH is normal. We have a client like this right now. Her TSH is actually like lower than it should be because I think she's over medicated, and her free T3 is still so low. There's definitely a conversion issue where her free T3, I think, is 2.3, like you said. And as a result, she's super bloated. Her bowels aren't moving. Like, her motility is definitely an issue. And she still has a lot of the symptoms of hypothyroidism because the conversion is just not there. There's definitely some gut stuff going on, some stress related stuff, some nervous system stuff, mineral stuff, all the things. So to kind of answer the question, I got on a little bit of a tangent, but yes, a full thyroid panel, antibodies, free T3, really, really helpful. We also like to look at iron labs. So looking at like ferritin, looking at iron, we do see like a lot of low ferritin, whether that's from the gut or something else. And then kind of correlated with that, I love to do HTMA, hair mineral testing, because it helps inform some of the pieces of the thyroid issue, some of the pieces of the iron issue, and then of course stool testing as well.
Yeah. Can you talk a little bit more about hair testing? Because again, that's another controversial test. And I do like hair testing, so I'm definitely, in favor of it. But there are some functional medicine practitioners who would dismiss it and say, the hair test isn't reliable. So yeah, like, why do you do hair testing on your clients?
Yeah. Hair testing is honestly, I love stool testing, but my favorite test that we do is hair testing, just because I've seen it change the game so quickly for so many people. Minerals are foundational to every metabolic process in the body. And so, kind of like I was saying earlier, we see a lot of clients that are just so depleted. They've done everything by the book, except for the fact that their minerals are just so depleted. So their body just doesn't have the manpower to do what it needs to do from a thyroid perspective, from an energy perspective, metabolism, all the things. So hair testing is controversial. I think one of the biggest things that you have to look for is a lab that doesn't chemically wash the hair, because that will alter the results. So we use Trace Elements Lab for hair testing. That's the only lab that I'll use. It's actually based here in Dallas, Fort Worth, where I am. And, there's tons of research supporting hair testing. You just have to look for it. But the reason that I like it is because it's really a window into your last kind of 3 months of mineral status. So a little different than like blood testing. Your blood test is going to look at, what does your magnesium look right now at this moment in time? And your body will always push minerals to your blood to keep things normal, quote unquote. If you have minerals off in your blood, likely there's a very serious issue. If your potassium's really high or really low, you're probably in the ER with some serious problems. So the hair testing can really help us to predict and prevent patterns before they ever happen in the blood, because your body will store minerals in your tissues, so your hair tissue. And so we can see patterns. And the most important thing about mineral testing is that you're going to look more at how the minerals are all interacting with each other versus just one mineral itself. Seeing that magnesium is high or low isn't as helpful as seeing, oh, wow, your magnesium is in a loss pattern, but your boron's really low. So that's why you're not absorbing the magnesium. Or, oh, you're having to use so much magnesium to have a bowel movement because you're constipated. Oh, it's actually because probably your sodium is really low and your potassium is really low. So it can help you to just understand the clinical picture a lot better.
All right. Well, thanks for explaining that. Definitely, I'm on board with hair testing. So it's great to have another practitioner that had a few others who talk about hair testing. Thanks for that. And anything else? Well, I guess, again, we jumped around. We covered a lot of different things, but is there anything else related to the gut, related to the thyroid, that I should have asked you that I didn't ask you? Anything else that you want to say?
I feel like we covered most of it. I'll probably think of something right when we turn this episode off. But yeah, I mean, just to kind of like bring it all together, like everything is connected. Your gut issues, your thyroid issues, supporting your gut is going to support your thyroid and vice versa. And so it's helpful, instead of isolating these pieces, it really is helpful to look at it all together. And if you've bottomed out with your gut and you haven't explored your thyroid, that would be a really important piece. Or, vice versa as well. There can be a lot going on in your gut that can affect your thyroid too.
All right. Well said. I do have one last question related to your health. And as far as someone who deals with chronic constipation, what's a realistic timetable to get someone to the point where if they're only having, let's say, a couple of bowel movements per week, where they get to the point where they're having regular bowel movements?
That's so hard to answer because, to be honest, sometimes I have clients that I'm like, okay, we're going to be in this for the long haul. This is going to take some time. And they see progress really quickly. And then the opposite. Sometimes I'm like, oh, this is super straightforward. We got this. And then it's just not. You start uncovering things. I always tell people expect, about a month for every year you've had symptoms. But I feel like that's not even the most helpful explanation because it can go so many different ways. The program that I run is 6 months. And the reason for that is because it does take time. Of course, there are people that see results a lot faster than that and some people that need longer. But, it doesn't change overnight, especially when it's related to chronic constipation. And if there's a thyroid component, if there is a thyroid component, I mean, as you know, it can take a while to figure out just the right cocktail of things that's going to work. And it's not always super straightforward. So just be gracious with yourself in the process. If you're on that journey, trust your gut. That sounds really cheesy, but if you feel like you're missing something, get a second opinion or ask somebody because there probably is another piece there.
Definitely agree. And Dr. Heather, how can people find out more about you, Dr. Heather? Tell them where to go, your website, again, the podcast, which I'll also be directing them to.
Yeah. So probably the easiest way to find me is just on Instagram. You can look up my name. It's just Dr. Heather Finley. Or my website is guttogetherprogram.com. I think Dr. Eric will put the link to the quiz if you want to take it. It's just a fun it takes you 2 minutes or less to take the quiz. But you'll get a little short video after you get your results of some things that you can do to improve whatever we determine is the cause of your bloating. So those are some good places to start.
All right. Sounds good. Yeah, we'll definitely include the links in the show notes, including the link to the quiz. And yeah, I think it's like 11 questions. So and they're pretty simple questions. So yeah, you're right. It only took maybe like a couple of minutes to go through that. Of course, check out Dr. Heather's podcast as well, including my interview. And thank you so much. This was really a great conversation. We covered a lot of different things related to both the gut and thyroid, and even a little bit outside of those, including the hair testing, which of course that also relates to the gut and thyroid. I mean, that covers everything. But again, thank you so much, Dr. Heather.
Thanks for having me.